Make that bowl dry.
That's good. Okay, I'm gonna perform hand hygiene. Introduce myself to the patient. Hello, my name's David. I'm a student nurse at Eastern Michigan University, and today I'm going to be performing a head-to-toe assessment on you. Can you tell me your name and date of birth?
Ian Purvis, March 7, 2000.
Okay. And can you tell me the year it is?
2021.
And who the president is?
Joe Biden.
And today, I did not tell him, so I'm going to announce it. I would ask him why they're here, and that is so I can perform a physical exam on him. The patient is well-developed, well-nourished. Okay. I'm going to next test for the muscle strength. So I'm going to test the resistance of the patient's face on my cheek. So if you can move your face towards my hand and the opposite way. Okay. Now I'm going to ask you to move your head forward and move it back. A little weak, but can you shoulder shrug for me? Okay, that's good strength. I'm going to ask you to squeeze both my hands, both my fingers, and move your palms down against the resistance of mine, and other way, move them up. Okay. And same thing with the feet. If I could have you raise your feet, I'm going to have you push your feet up. Good. Okay. Push them down. Okay. So the patient's muscle strength is 3 out of 5 on a scale of 1 to 5 and is symmetrical and strong bilaterally in both upper and lower extremities. I'm going to test for the 2 dermatomes on the right upper arm for the sharp and soft sensation, as well as the 2 dermatomes on the left upper arm for the sharp and soft sensation. So I'm going to ask you to close your eyes. I'm going to ask you to close your eyes. Why are you looking like that? And you're going to tell me if it is sharp or soft.
Sharp. Soft. Sharp. Soft.
Okay. So the patient's sensation is symmetrical and intact bilaterally in upper and lower extremities. Next, I'm going to test for the reflexes and state the correct cranial nerve for each maneuver. So first, we're going to start with the biceps. So I'm going to ask you to lay your palm flat, and this is between cranial nerve 5 and 6. Okay. Now I'm going to test for the triceps, which is cranial nerve 7. So if you want to flip your arm around. Tricep is looking a bit small, but okay. Next, I'm going to check for the radial brachialis, which is C6 in the wrist. So I'm going to have you to lay your palm flat again. Okay. And next, I'm going to check for the patellar in the L4. So I'm going to have you raise your leg up a little bit. Actually, lay it flat. Okay. And now I'm going to check for the Achilles in the S1. And finally, I'm going to check for the Bushinski in the S1 as well. So for this one, it's kind of off camera a little bit. I'm going to raise this foot. Okay. All the DTRs, including Bushinski, are intact. So next, I am going to assess the station in the gait. So I'm going to ask you to stand up. I'll move the chair out of the way for a second, and I'm going to have you just walk straight. Okay. Then I'm going to have you walk back on your heels. Okay, and then walk forward on your toes. And then walk head to toe in a straight line. Straight back to this chair. We can sit back down. Okay, walk to the chair. So the patient's station is normal and their gait is normal in the tandem gait. So next I'm going to inspect the HEENT, or the H-E-E-N-T. So I'm going to check their eyes first for the perla. So you just look straight. Okay. So both eyes have dilated, and if you want to look straight again, go ahead, get down. Follow the pen. Okay. Next, I'm going to check the nose. I'm assessing for the presence or the absence of any nasal flaring. I do not see any, so there's no nasal flaring. I'm going to assess the mouth next for the circomial cyanosis around the mouth. I'm assessing the color, which is of the mucous membrane, and the presence of absence of the pursed lip breathing. There is no circomial cyanosis. The mucous membranes are pink, moist, and there is no pursed lip breathing noted. Next, I'm checking the neck. I'm checking for the assess for accessory muscle use or presence of JVD. Okay. I see no accessory muscle use. I see no jugular vein distension, and I did this by comparing one side to the other. Okay. Now I'm going to palpate the neck. I'm going to palpate the carotid arteries one side at a time with my fingertips. Go back. Okay. I palpate the carotid arteries. I feel no thrills. Now I'm going to osculate the neck. So I'm going to do this by using the bellows stethoscope one side at a time and instruct the patient to hold a breath while osculating each side. So if you don't mind holding your breath for me as soon as I get this on you. Okay, you can breathe. And then hold it again. Okay, I do not osculate any carotid brutes. So next I'm going to inspect the chest. I'm going to assess for contour and shape of the patient's chest. Very firm. I inspected the contour and shape of the chest wall and evaluated the patient's breathing effort. So I saw no visual abnormalities in shape, no burl chest, no signs of scoliosis, pectus caradium or pectus excavitium. I noted no visual shortness of breath, no intercostal retractions, and no patient tripoding. Now I'm going to palpate the posterior lungs filled with palm and handing using the 6 positions on the posterior wall of chest and the 4 positions on the anterior wall. Okay, I'm going to get the anterior wall now. Okay. I palpated no abnormal lung vibrations in either the anterior or posterior lung fields. Now I'm going to osculate the anterior and posterior lung fields over 6 positions on the anterior wall and 8 positions on the posterior wall. So you can go ahead and breathe normally. Okay, I'm going to listen to your back now. Okay, the lateral lung fields, I'm next going to osculate the lateral lung fields under both the axilla. So if you don't mind raising your arm up for me. Okay, you go ahead and lower that. I'm going to do it on the other side. Go back. Okay, lungs are clear bilaterally, anterior and posterior. No wheezes, rhonchi, or crackles noted. So next I'm going to inspect the anterior chest wall and the cardiovascular system. I'm going to assess the anterior chest wall over the heart valvular areas for abnormal heaves. I see no abnormalities. I observe no heaves. Observe no abnormality heaves over the anterior chest wall. So next I'm going to palpate the anterior chest wall over the aortic, the pulmomic, the Erb's point, the tricuspid, and the mitral valves, feeling for rubs, abnormal vibrations, or thrills. Okay. I palpate no thrills or abnormal vibrations over the valvular areas of the heart. Next, I'm going to auscultate the anterior chest walls of the heart. I'm going to, I would auscultate cardiac sounds using my bell and diaphragm over all the valvular areas and the Erb's point with the patient in both the sitting and lying positions. And if I have difficulty hearing the heart sounds due to obesity, chest or breast tissue, I would place the patient into left lateral debucous position. Okay. Next, I'm going to assess the rhythm of the heart rate. I'm going to listen to the heartbeats and identify the presence of normal, regular rhythm of the heartbeat with their stethoscope. Okay. The heartbeat is normal. It has a regular rhythm and no abnormalities. I hear normal S1 and S2 heart sounds. I hear regular heart rate and rhythm. I hear no murmurs, gallops, or rubs in S3 or S4. So next, I'm going to inspect the cap refill and the right and left hands. Okay. There is normal cap refill lasting less than 2 seconds on both left and right hand fingers and is brisk. Okay, next I'm going to inspect and palpate for peripheral edema. So I'm going to ask you to roll your sleeves up a little bit as much as you can. That's perfect. Currently looking for edema. I'm going to be checking down here as well. Okay. I do not observe any signs of edema on either the right or left upper extremities, hands, or lower extremities, or feet. Yep. So next I'm going to palpate of pulses. So I'm going to start with the brachial pulse. Using 2 fingers, you can go ahead and rest it down. Oops. Let me get both sides. Okay, and the radial pulse. Now the popliteal pulse. Okay, and the posterior tibial and the dorsio-pedial pulses. The brachial, radial, femoral, popliteal, posterior tibial, and dorsio pedis pulses were palpated in symmetrical and they were 3+ in quality bilaterally throughout. Next, I'm going to check for the warmth and temperature of the extremities. The upper and lower extremities are warm to touch. Now I'm going to inspect the abdomen. The abdomen is concave without any visible scars. I see no heaves, vibrations, or excessively active bowel movements across the abdomen. I see no bruises or prominent venous patterns or engorgement of veins around the umbilicus. And now I'm going to osculate the abdomen, listening in all 4 quadrants. I hear hyperactive bowel sounds across all 4 quadrants. I'm going to osculate the aorta, the renal arteries, the iliac arteries, and I'm going to state that I would osculate the femoral arteries. I do not hear any brutes or abnormal blood turbulence or venous hums over the abdominal aorta, renal, iliac, and or the femoral areas of the abdomen. Next, I'm going to palpate the abdomen. Okay. I do not palpate any areas of the abdomen which are tender, distended, and I have not noted any masses with palpation. Finally, I'm going to percuss the abdomen. Way back as far as you can. Got a canine here trying to protect somebody from getting hit. It's okay, Kodak. I noted normal bowel innovation when I perform percussion of the abdomen, and that completes my head to toe assessment.